Hello everyone. Our today's topic is anemia during pregnancy and I am Dr. Swati Mehta explaining about the treatment of anemia during pregnancy in homeopathy. Anemia is one of the most common medical conditions affecting pregnant women worldwide and understanding it essential for protecting both the mother and the baby. Anemia is a condition in which the hemoglobin level in the blood falls below normal and it reducing the oxygen carrying capacity of the blood. In pregnancy, anemia affects a significant number of women. In some populations, it can affect up to 80% of pregnant women. The risk is higher in teenage mothers and women from lower socioeconomic backgrounds. Iron and folic acid supplementation during pregnancy helps prevents complication associated with the anemia. In non-pregnant women, anemia is defined as hemoglobin levels below 12 gram percentage, while in pregnant women, according to WHO, hemoglobin level below 11 gram percentage indicates anemia. Hematocrit values less than 33% also signifies anemia. During pregnancy, hemoglobin level between 10 to 12 gram per dilution are considered physiological anemia, primarily due to an increase in plasma volume that exceeds the rise in RBC volume. Classification of anemia as per ICMR and WHO. Mild, that means 10 to 11 gram per dilution in ICMR, while WHO says 9 to 11 gram. Moderate, that is 7 to 10 in ICMR, while 7 to 9 in WHO. Severe, that is 4 to 7 in ICMR, and less than 7 gram per dilution is in WHO. And very severe means it is less than 4 in both ICMR and WHO. Erythropoiesis refers to the production of RBCs, that means red blood cells. In adults, this process occurs in the bone marrow. Red blood cells develops through several stages including pronomoblast, normoblast, reticulocytes, mature erythrocytes. A mature RBC lives for about 120 days before it is broken down. The hemoglobin from these cells is then converted into iron, stores and bile pigments. Several factors are required for normal RBC production. They include iron, folic acid, vitamin B12, protein, healthy bone marrow. Deficiency of any of these nutrients can lead to anemia. During pregnancy, the demand for these nutrients increases significantly. There are several causes of anemia during pregnancy. This includes iron deficiency, folic acid deficiency, vitamin B12 deficiency, chronic blood loss, infections, genetic blood disorders. Among these, iron deficiency anemia remains the most common. The most common type is nutritional anemia, which is mainly caused by iron deficiency. This highlights the importance of proper nutrition and supplementation during pregnancy. In India, the prevalence range between 50 to 70%, whereas in United States it is much lower, around 2 to 4%. Classification of anemia divided into two, physiological and pathological. Physiological usually during pregnancy, while pathological there are various causes: deficiency anemia, hemorrhagic anemia, hemolytic anemia, bone marrow insufficiency anemia, and hemoglobinopathies anemia. During pregnancy, the body undergoes several physiological changes. The plasma volume increases by about 50%, while the RBC mass increases only about 25 to 33%. This imbalance causes hemodilution, which leads to decrease in hemoglobin concentration. This condition is known as physiological anemia of pregnancy, and it is considered a normal adaptation to support fetal development. During pregnancy, maternal plasma volume increases progressively. So more of this expansion occur before 32 to 34 weeks of gestation, with minimal changes afterwards. RBC volume rise by approximately 25% or 300 ml later in pregnancy. This relative hemodilution leads to a decrease in hemoglobin concentration, often resembling iron deficiency anemia. During pregnancy, blood volume increases by about 40 to 45%. However, plasma increases more than RBCs, causing a dilution of hemoglobin levels. Additionally, repeated pregnancies with short intervals can deplete the iron stores, and this leads to higher risk of iron deficiency anemia. During pregnancy, total 800 to 1000 milligram extra iron is required. 300 milligram for fetus and 50 milligram for placenta. So 400 to 500 milligram for increased RBC mass and 250 milligram iron lost during delivery. 220 milligram is basal loss. Pregnancy significantly increases the body's iron requirement. Normally, the diet provides around 14 milligrams of iron per day, but only 5 to 10% is absorbed. During early pregnancy, the extra requirement is about 2 to 3 milligrams per day, and in late pregnancy, it is increased to 6 to 7 milligrams per day. For this reason, doctors recommend 40 to 60 milligrams of elemental iron daily during pregnancy. So absorption is defective. Our miasm is tubercular. So in anemia, you can use 1 dose of tuberculinum with the indicated medicine will help in proper absorption of iron. Symptoms of anemia: yellowness of conjunctiva, paleness and coldness, and yellowing of the skin. There is shortness of breath, muscular weakness, changes in the stool color. Patient feels fatigue, dizziness, and fainting. Blood pressure is low. There is palpitation in heart and rapid heart rate. Patient may have chest pain and enlargement of the spleen in very severe condition of anemia. There are several types of anemia during pregnancy: iron deficiency anemia, folate deficiency anemia, vitamin B12 deficiency, and pregnancy related anemia. The other causes, if we can consider, that is maturation disorders, hemolytic anemia, acute bleeding, marrow damage, inflammation, neoplasma, and chronic diseases. Iron deficiency anemia are common about 95% of all anemia cases. Normally, the blood requires about 10 milligram of iron daily, but during pregnancy, the requirement increases to 15 milligram per day. In this increased demand is not met through diet or supplements, then anemia develops. Causes of iron deficiency anemia includes poor dietary intake, poor absorption of iron, increased demand during pregnancy, chronic blood loss. And conditions such as abnormal uterine bleeding or piles may also lead to iron loss. So here homeopathy helps. First, in deficiency in assimilation, silicea and tuberculinum are the medicine. For the blood loss, we can have anti-hemorrhagic drugs like phosphorus, and for piles and uterine bleeding, we already discussed some medicines in the previous lecture. The most common sign of anemia is pallor, which can be seen in the face, palms, nails, beads, and conjunctiva. Other symptoms include weakness and fatigue, shortness of breath, palpitation, brittle nails, glossitis, and stomatitis. In severe cases, nail may become spoon-shaped. For investigation, several laboratory tests required. They include hemoglobin level, RBC count, serum iron levels, iron binding capacity, transferrin saturation. In iron deficiency anemia, blood smear typically shows microcytic and hypochromic red blood cells. Treatment focuses on correcting the iron deficiency. Dietary sources of iron include meat, liver, green leafy vegetables, legumes, and iron absorption improves when taking vitamin C rich foods like citrus fruits. Tea, coffee, calcium, and some cereals may be reduced iron absorption. Iron supplementation is generally not recommended during the first trimester due to a slight high risk of miscarriage and gastrointestinal side effects. But homeopathically, biochemic ferrum phos 3x we can use from very first day of the pregnancy. With that, we have to advise patient for certain diets, that is green leafy vegetables, that is सरसों का साग, choli, sawa, salgam, cereals like ragi, jawar, bajra, pulses which are sprouted, jaggery and dates. We must recommend them because they are the richest source of iron, and there is a myth that this causes miscarriage, but it is not. Those who are non-vegetarian then can have animal flesh, meat and liver, and vitamin C, that is lemon, orange and guava, are used in our diet, then it causes proper absorption of iron. Iron supplementation in modern medicine not recommended in the first trimester because there are higher risk of miscarriage, birth defects and bacterial infection because bacteria grows after taking iron supplementation. And here the doses are given, they are of the modern medicine. After starting iron therapy, several improvements can be observed. These includes improved energy levels, better appetite, improved in appearance. Hemoglobin typically rise by 0.5 to 0.7 grams per week and reticulocytes counts increases within 7 to 10 days. As per my recommendation, biochemically ferrum phos 3x 4 tablets 3 times a day, if it is given to the patient, it increases 1 gram of hemoglobin per month. This is the modern medicine treatment where some cases oral iron is not sufficient or cannot be tolerated, then perinatal iron therapy may be used. Iron sucrose can be administered intravenously and dosage is calculated based on the patient's weight and the iron deficit. Hemoglobin level usually increases by about 1 gram per week. Blood transfusion is indicated when there is a severe anemia presenting after 36 weeks or patient is having anemia after acute blood loss, that may be because of APH or PPH. There may be present of infections or there is lack of response to oral or perinatal treatment. At that time we have to give blood transfusion. Megaloblastic anemia occurs due to deficiency of folic acid and vitamin B12. During pregnancy, the requirement of folic acid increases significantly and the daily requirement rises to around 1 milligram per day. Folic acid deficiency anemia is relatively uncommon but can occur due to poor dietary intake, malabsorption, increased requirement during pregnancy, certain medication or medical conditions, and anti-epileptic drugs are mainly affected. Symptoms may include digestive disturbances, nausea, diarrhea, vomiting, and a red glossy tongue. Investigation in case of folic acid deficiency anemia, the blood smear, then serum folate concentration, and bone marrow examination. The treatment indicates consumption of diet high in folic acid, oral folic acid supplementation at a dose of 5 to 15 milligram per day. Vitamin B12 deficiency anemia is rare during pregnancy. It may occur due to malabsorption, lack of intrinsic factor, gastric disorders. The treatment involves intramuscular injections of vitamin B12, that is of the modern medicine. Folic acid should never be given alone in B12 deficiency because it may worsen the neurological symptoms. In homeopathy, we can use our medicine which is indicated symptomatically. Hemolytic anemia occurs when RBC are destroyed prematurely. It can be congenital such as thalassemia or sickle cell anemia, acquired due to infections, toxins or drugs. Patient often shows signs such as jaundice, enlarged spleen and dark stools. Autoimmune hemolytic anemia. It is a genetic disorder inherited in autosomal dominant pattern characterized by deficiency in cell membrane lipoprotein, resulting in increased rigidity of the RBCs and their subsequent destruction primarily occur in the spleen. On investigation of hemolytic anemia, we can find increased level of serum bilirubin, in urine increased urobilinogen, in stool elevated stercobilinogen. In blood smear, we can find the normocytic normochromic anemia along with the specific cell morphology. It is described here. For the management of hemolytic anemia, blood transfusion is must, and in case of acute episodes, folic acid and iron supplementation may be appropriate. Splenectomy can be advantageous in case of spherocytosis and certain instances of thalassemia major. However, it should be avoided during pregnancy. It is important to prevent triggering factors such as hypoxia in spherocytosis and exposure to oxidative agents in G6PD deficiency. Thalassemia is a genetic blood disorder caused by defective production of hemoglobin chains. It can be classified into alpha thalassemia and beta thalassemia. Mild cases may cause only mild anemia, but several cases can significantly affect the pregnancy outcomes. Thalassemia minor patient experience mild progressively worsening anemia during pregnancy, while in beta thalassemia major manifest in childhood and often results in mortality, typically in the second or third decade of the life. Beta thalassemia major is infrequently seen in pregnant women. However, when it does occur, the outcome is generally unfavorable. During mid-pregnancy, anemia often intensified significantly and potentially leading to the heart failure. Sickle cell anemia is hereditary disorder where RBCs become sickle shape under low oxygen condition. These abnormal cells block the small blood vessels and cause painful crisis and organ damage. During pregnancy, sickle cell disease increases the risk of infection, fetal growth restriction, and preterm labor. The symptoms of anemia vary depending on the severity. Common symptoms are fatigue, breathlessness, palpitation, swelling of feet, and severe anemia may lead to heart failure and serious complications. Management of sickle cell disease during labor prevents hypoxia, dehydration, and acidosis. It manages crisis with rehydration and bicarbonate administration, analgesics, and either heparin or low molecular weight dextrane administered of the prophylactic antibiotics. All these are the treatment of modern medicine. The high-risk group includes adolescent females, multiparous women, those with multiple pregnancies, and individuals from lower socioeconomic backgrounds. Mild anemia is often asymptomatic, while in severe anemia, the clinical signs may present facial puffiness, elevated jugular venous pressure, tachycardia, tachypnea, crackles at the lung bases, hepatosplenomegaly, and pitting edema on the abdominal wall and legs. Additional findings can include hemic murmur and signs of cardiac failure. Other manifestations include glossitis, stomatitis, cellulitis, and brittle hair. Anemia can have serious effects on both mother and fetus. Maternal risk includes predisposed to infection like UTI and puerperal sepsis, increased risk of PPH, subinvolution of the uterus, lactation failure, maternal mortality due to cardiac failure, cerebral hypoxia, sepsis, or thromboembolism. Effect on fetus causes abortion, preterm birth, intrauterine growth retarded child, or intrauterine death, low Apgar score at the birth, neonatal more susceptible for anemia and infections. So infection leads to the mortality. In case of anemia, the most critical periods are 28 to 30 weeks of pregnancy, in labor immediately after delivery, and early puerperium, where we have to cope up with the heart failure due to cardiac load. We must have proper history of the pregnancy of the woman with anemia, about the age parity and diet especially, and on examination we can find out what are the cause. Diagnosis involves evaluating hemoglobin levels, RBC indices, peripheral blood smear, serum ferritin and iron levels. This test helps determine the type and severity of the anemia. Different slides shows RBCs and its abnormality. RBC indices are provided here. Special investigations like serum ferritin, serum iron binding capacity, percentage saturation of transferrin, and RBC protoporphyrin must be done. Here different values are given for the difference between iron deficiency anemia and thalassemia. Whenever required this other investigation, we can follow the things. Urine examination for RBCs, stool examination for occult blood and OVA, bone marrow examination for refractory the anemia, X-ray test for pulmonary TB, and serum creatinine for renal disease. In management of labor, it must be supervised properly. Proper counseling and consent of the patient and families must be taken. If required, IV fluids or blood or plasma volume can be given to the patient. Intermittent oxygen also, if required, can be given to the patient. Must prevent the infection and blood loss. Strict aseptic precautions and minimal PV examination. Prophylactic antibiotics can be given in modern medicine. We can give pyrogenum 10m or pyrogenum 1m, one dose before the labor. And if required, diuretics to be given to the patient, or in homeopathy we can give Apis mother tincture as a diuretic. To cut short the second stage of labor, we can use forceps, but before doing forceps we have to do episiotomy, so chances of bleeding is more. That's why again we have to give phosphorus 200 one dose. The other modern medicine, if required, then oxytocin drip to activate the labor, or according to homeopathy, if there is a everything is loose and open but there is no expulsive movement, cecal core can be prescribed. Normal blood loss is acceptable, but abnormal blood loss is not acceptable. So IV fluids must be given to the patient to maintain the volume. Postnatal management includes iron supplementation, nutritional counseling, and family planning. Contraception must be advised. These measures help restore maternal health and prevent anemia in future pregnancies. In therapeutics, two medicines are most important, that is Silesia and tuberculinum, where the body is unable to properly absorb and utilize the nutrients even when the diet is adequate. In case of Silesia, there is defective nutrition and poor assimilation. Patient is thin, weak, and undernourished. They are delicate, chilly, and lacking stamina with low resistant infection. There may be chronic weakness and anemia and slow development. Tuberculinum is an intercurrent remedy where patient is having tubercular constitution, poor assimilation, rapid weight loss, and recurrent weakness. Patient is thin, weak, and anemic, and patient is restless, irritability, and constant desire for change, where there is a history of repeated infection, especially respiratory issues. Patient is having low immunity, poor nutrition, and progressive weakness indicates tuberculinum. So tuberculinum and Silesia are, you can say, intercurrent for where there is a poor assimilation with our indicated medicine. Now let us understand the role of ferrum phos in the treatment of anemia from a homeopathic perspective. According to Borix Materia Medica, it is mentioned in the introduction that ferrum phos 3x help increase hemoglobin in level in the pale anemic individuals, and that is in italics. This remedy is indicated who are not strong and robust. Instead, they appear delicate and nervous. Patient is having false plethora, so they looks like non-anemic, but when we can advise them to go for estimation of hemoglobin, it is not found normal. Patient may have palpitation of the heart, rapid short and quick pulse. This medicine acts on the venous circulation, so it helps in condition involving local passive congestion and bleeding causes by increased blood flow or hyperemia. Patient often experiences great prostration and exhaustion. They can hardly move or perform any normal activities. On mental level, patient may become very talkative, cheerful, and sometimes usually excited. In some cases, there may be a temporary mental excitement or mild mania due to cerebral irritation. Emotionally, they are indifferent to things that usually give pleasure. They may also develop aversion to company and fear of crowds. Often includes drowsiness along with restlessness and sleepiness. Physically, patients is feel heat in the body with sweaty palms and hands. Because of this characteristic, ferrum phos becomes an important remedy in homeopathic management of early stage of anemia, where there is a weakness, palpitation, and circulatory disturbance are present. Ferrum metallicum is indicated to young anemic individuals who appear strong and healthy but are actually very weak internally. They are having pseudoplethora, and so there is a weakness. Even simple activities like walking or standing becomes difficult. Patient may show pallor and dryness of the skin along with dryness of the mouth. In many young individuals with anemia, the lips may appear alternately pale and flushed. Emotionally, they are very sensitive and unstable, sometimes weeping and laughing excessively without any clear reason. You can say they are the nervous or hysterical. The vagina may feel excessively dry and there is a painful intercourse during pregnancy. In menstrual history, there is a pale watery menstrual bleeding and that occurs too early and very profuse and lasts for the longer time than the normal. And with that, patient is having labor like pain and there is tendency towards repeated miscarriages because abortion, one of the cause is anemia. There is oversensitivity in the vulva, so there is itching and rush of blood. Patient is very sensitive to noise and slightest sound may feels unbearable. Patient is having vertigo and ringing in the ears. So patient may have a very strong appetite but sometimes described as voracious hunger and there may develop a strong aversion to sour food and attempting to eat such food may even trigger the diarrhea. The apparent strength with internal weakness, circulatory disturbances, emotional sensitivity, and menstrual irregularities, ferrum metallicum is the valuable medicine for homeopathy. The another useful homeopathic remedy for anemia is lecithinum. This medicine is prepared from the lecithin, phosphorus containing organic substance that is found in egg yolk and animal brain tissues. Because of its rich nutritional components, it plays an important role in improving the body's metabolism and blood fermentation. In homeopathic practice, lecithin is known to improve general nutrition, particularly the nutrition of the blood. And for this reason, it is considered very helpful in case of anemia and general debility. Patient having extreme tiredness and weakness, shortness of breath, loss of body weight or loss of flesh. This medicine helps to increase the number of RBCs and improve the level of hemoglobin in the blood. Because of this, the patient gradually shows better vitality, strength, and overall improvement in health. Mentally, the patient may be forgetful, dull, and confused, difficulty in concentrating or remembering the things. That is common feature is loss of appetite and patient feels thirsty always. Craving for stimulants like wine and coffee is very uncommon, but it is a peculiar symptom. Because lecithinum improves blood nutrition, energy levels, and mental clarity, it becomes a valuable remedy for anemia associated with weakness, weight loss, and mental fatigue. China is a medicine where anemia develops by loss of vital fluids. It is indicated in case of weakness and anemia develops after excessive loss of body fluids, such as severe diarrhea, hemorrhage, prolonged illness, or other exhausting discharges. Patient is very weak, extremely tired, and exhausted. There is a development of dropsy or swelling due to fluid imbalance. Mentally, patient is apathetic and indifferent. Many thoughts crowded in the mind, making difficult her to sleep. Restless at night, tossing and turning in the bed. The pulse may be irregular, sometimes weak and rapid, followed by strong and harder beats. The patient may even experience suffocative attacks or fainting episodes due to weakness. Patients are very sensitive and nervous and they upset upon light, noise, pain, and even simple instructions. Emotionally, they are stubborn and disobedient with fixed ideas. They developed usually fears such as fear of dog or other animals. Patient dislikes for both mental and physical work. Patient always imaginative thoughts that she is known as air castles. Patient reluctant to speak and feel as if they are losing control over their mind. So wherever the anemia caused by loss of vital fluids along with the extreme weakness and nervous sensitivity, we can think about China. Thank you for watching this presentation on anemia and its homeopathic management. In homeopathy, we do not treat just a disease, we treat the individual as a whole. So the symptoms totality includes physical signs and mental state of the individual characteristics. Homeopathy aims to improve nutrition, enhance absorption, increase hemoglobin level, and restore overall vitality in a gentle and holistic way. And the tuberculum is an intercurrent remedy which helps to increase proper assimilation and can help for the absorption of the iron from the diet. I hope this presentation helped you understand the different aspects of anemia and the role of homeopathic remedy and its management. If you found this video helpful, please like, share and subscribe to the channel for more educational concept. Thanks a lot.